watching Ayit TV. Ayit TV, empowering you.
The Medtech Hackathon 2023 is here, and so is a group of trained and tremendous judges ready to make a tremendous conclusion, if I can say so. Who will be the winner to take the biggest cash prize today? I don't know. Just keep your eyes at Ayita TV, empowering you. My name is Bridget Cimenta, and yes, it is the final day. This is day 2 of the hackathon, but day 3, according to CamTech preparations and everything that has been going on according to the organization. Today is day 3 and it is the final day. We are here, that is the Faculty of Interdisciplinary Studies at Mbara University of Science and Technology, just as usual, to bring the events live just while you are watching us from. You could be at your office, you could be at your workplace, you could be at home, you could be everywhere. Maybe you are traveling, because Ayita TV reaches a wider network. That means you could be in the diaspora, you could be everywhere. Just keep your eyes at Ayita TV, empowering you. Look at the people that are around. Look at the hackers. I think the person behind my camera could take you through, and you see the people that are in the room, the few groups that are in the room. Yes, I know that the mentors are not around yet at the moment because they have gone to the hack store, to prepare for the event as well. And in here there are very many hackers, as you can see, different groups. Others as well are outside, others are in the hack stores just to plan for their pitches. Yes, today we have a lot. Yes, busy. The hackers are busy hacking, but then I think we can just get one of them to talk to us exactly what are they doing here. Hello, how are you?
I'm good, how are you?
We are live at Ayita TV. Who am I talking to?
I'm Trifin Nyakecho.
Trifin. Which group is this?
This is a group working on a solution to do with cardiovascular diseases.
Oh, which kind of diseases are we talking about?
We're looking at hypertension, heart failure, and all the diseases related to the heart. Yeah.
Why did you choose this?
So maybe you should know that statistically, cardiovascular diseases are one of the leading causes of death globally, and they are usually termed as the silent killers. So you find that people collapse and then suddenly die because they are not aware that they had these conditions. So we thought about creating an innovation to help people identify these conditions early enough and then be able to solve them before they reach the extremes.
Okay, do you mind sharing the solution? Is it an application? What are we talking about?
Yeah, so the solution we are giving is probably is actually bridging the knowledge gap, because the biggest problem with CVDs is the knowledge gap. So we're creating a mobile application that is able to give people the knowledge that they need about these diseases, to also give them access to expert opinions, so for example specialists in the area, and also to help them guide their choices in regards to lifestyle, by giving them personal coaches. Yeah,
I can let you work as we proceed. Thank you so much.
All right.
Okay. The hackers group number 11. What exactly are they solving here? What is their project? What is their problem? They will be telling us. Hello, how are you?
Hi, I'm Leo Kinyera.
Yes?
Yeah, I'm Leo Kinyera.
Kinyera.
Yeah.
Oh, Kinyera, are you Ugandan?
Yeah, sure. I'm Ugandan.
I have never heard this name before. Are you from the west, from the north, from the east?
Not really. I'm actually from Gulu.
Okay.
Yeah.
So are you the team leader of Group 11?
No, not really. I'm actually on the software engineering team, part of the team. Yeah.
So what are you doing exactly here? What is your project?
We are actually trying to monitor and also provide for better management of neonatal issues.
Neonatal issues, what exactly?
issues to do with maternal health for the parents. So usually, if the non-communicable diseases are not monitored well for the cases of the mother, we tend to have deaths during times of pregnancy. Times of birth. Yeah. So if these are well taken care of and monitored well, doctors can actually know exactly how to treat a particular mother at a particular time when giving birth, so that we get rid of these unnecessary deaths. Yeah.
I think many solutions have been brought on board. How different will your idea be?
Well, currently we're using maternal health cards to do that.
We can actually face in the camera. Maybe I could stand this side. So you are still telling me?
Yeah, so currently we're using maternal health cards to do these records and then know the past treatments that these patients have had. Yeah, so we are trying to create a system that's more digital and can be used like for the entire time. Like we don't have to produce cards every single time and again. But then also we want to create a communication link with a patient, the mother herself, such that in any case, maybe say you're having hypertension and you have some new reading about your high blood pressure, so you keep on updating on a given application, just that the next time you go to the doctor, we know that this happened at this particular time and this could particularly cause, we could predict something and then we treat you according to that. Yeah.
That's amazing. So how many disciplines are here, like from different disciplines? How many disciplines are you here?
Yeah, so far we are 3. Yeah, we're having the biomedical engineering department, the software, and then the business as well.
Amazing. What do you see as what do you anticipate as the benefits of this project in case you have already started operating?
Well, we're targeting subscriptions for the mothers at the time when maybe you're pregnant and then you start doing this. Obviously, we're going to give you a card and it has a QR code so that maybe it can be read by the health personnel. But then also at the time when you get pregnant, you can subscribe for it, like for a particular 9 months. And then also we plan to sell these cards every time and again every day, because we're having we're reporting pregnancy cases almost on a daily basis in hospitals. Yeah, so that's where we're still kind of figuring out how we're going to make the money, though we are still hacking, like we're still trying to hack.
Okay, I wish you the best.
Thank you very much.
All right, that was the Team 11, and it is on to maternal health and neonatal health. We wish them the best. Still here next to the other team. Okay, this is team number
21.
Team number 21. So what are we doing here? Business, technology, medical field, or anything?
So on this table, we are working on both business and technology. We are trying to come up with a medical reminder app that can remind a patient who is having a communicable disease, for example, hypertension and diabetes. You know, these patients tend to forget when to take their medicine, maybe because they are so busy or maybe they're tired of this medication. So we are coming up with a medical reminder app that can just like remind them of the time, of the schedule, and of the medicine that they're supposed to take.
So you mean when I am home, exactly how is it going to work? I just want to know how I will be reminded.
Install it in your phone. Yes. So like you could be busy doing something or you could be sleeping. So when you go to the hospital, they'll just like guide you on how to use it. So you could be busy. It could be a busy schedule that can just remind you like it's time to take the medicine.
Okay. Why of the 4 thematic areas did you choose the non-communicable?
We chose the non-communicable diseases because 33% of the death in Uganda are due to these diseases, and most of these diseases that kill the people, 23% of these deaths are due to non-adherence to the medical schedules. Yes.
So who could be your partners in case, maybe, yes, I know it will be an application. So maybe you could tell us how it will work. And maybe you also have partners, the people that you'll be partnering with. Will you connect with hospitals or offices? I just want to know.
Okay, so in case, it has to be a success, of course. So after it being a success, we plan to partner with hospitals, could be referral hospitals or private hospitals, so that every time a patient comes to the hospital, they're advised to take up this app. Yeah.
That is amazing. Thank you so much. That is all. And I wish you the best. But in case you win, how will you feel?
So happy, of course.
When will you start to implement?
As early as today and tomorrow.
Okay, thank you so much. Yes, another lady seated on my right. Yes, how are you?
I'm okay. How are you?
I'm good. So why choose to come for this ideation, innovations, conference or summit?
Oh, personally, it was, how can I say, it's not an experience. This is my first time to attend Camtech, but then one of my colleagues had attended Camtech, and I felt like, yeah, they are getting a lot of ideas from Camtech. Being a biomedical engineering student, we do a lot of projects. So I looked at coming to Camtech as one way of getting ideas so that I can go back and then make these ideas, maybe get solutions for them and then write about them.
Okay. By the way, sorry, whom am I talking to and which institution are we talking to as well?
Maria Regis Nancy, I'm coming from Accurate Ernest Cook Ultrasound Research and Education Institute.
Pardon?
Ernest Cook Ultrasound Research and Education Institute, Accurate in Mengo.
Oh, you're from Mengo. How did you know about this?
Of course, Camtech, it is we actually do an internship. So Camtech is one of internship places for research. And actually not research but innovation. So of course I had to get to know about it from our lecturers and all those people that take research and innovation as a team at our school.
Okay, have you built any innovations before or you are starting just now?
Right now I've got ideas. However, I've worked on some projects. Yes.
Mind sharing?
Okay, I can mind sharing. Okay, I don't mind, but then I've worked on monitoring of oxygen levels, on oxygen cylinders, that is in the hospitals, the healthcare practitioners, and then some others.
Okay, fine. I think there is something that we shared on the first day at the summit, and it was really amazing. It was interesting. So, just a simple question. How do you monitor, how do you manage your everyday life? I see you are developing innovations, you are managing school, you told me you work as well. How do you manage that in order to keep in a good state? You said you are never stressed at all. So I just want you to tell us, especially to the people who are watching us, there are very many young people, but they get stressed even just by a simple thing. Maybe just only maybe this, what you are doing here, it just stresses them. Or thinking about monies and stuff like that.
The first thing I can say, stress not on things that you cannot change. The mere fact that you cannot change anything about something, you don't need to stress about it. I mean, leave it. Another thing is trusting the process. You're 20 years old, you want to be rich like a person that is 60 years old. I mean, what is that?
Live within your limits.
That is right. Because when you actually make it a point to live within your limits, you'll have less stress. I mean, okay, there is that stress that you you can't help having.
Can't handle.
There is that normal stress, but then there is this stress. I mean, you're stressing yourself. You want to have those nice things. You can't access them. It is not your turn yet. I mean, why should you? I feel like you should not stress to things you cannot change, and then you need to trust the process and get there when you get there. Because personally, there are things that I can access right now, but back then I could not access. You see? Yeah, that's how I'm trying to live with it. I mean, of course, I make a timetable for myself. I make a timetable for myself, and then I know I'm supposed to do this and this. These are must-dos. I mean, in a day, this is what I'm supposed to do, this and this. And then maybe some others. Of course, my main goal as a student is go to school and study. Yeah.
And succeed.
Yes, I have to study. That is one thing I must do. And then the rest should come as by the way,
side things. Okay, as we conclude, a word to the young people, a word to the beautiful girls like you out there. You could motivate one as a woman in technology.
Trust the process.
Trust the process. Okay, thank you so much, Maria. That is Maria, and she came all the way from Mengo. I told you, just right here, there are very many universities and very many people from various countries around the globe. Stay on AEDU TV. Told you that we have people, mentors, participants from all over the diaspora. Here is Mr.
Dr. Armand.
Sorry about that. Here is Dr. Armand, all the way from, is it Burundi?
Burundi, yes.
Yeah, he's from Burundi, and he is a mentor in health. So, you are welcome to Uganda.
Yeah, thank you so much.
Has this been your first time to Uganda or your
No, my third time.
third time, still due to innovations or other business?
I was attending hackathon only.
Hackathon. So every time you've come to Uganda, it has always...
For hackathon only.
You should also try to come out to see maybe the different tourist attractions within here, because we have a lot.
Yes, I think I will plan for it in the coming days.
Okay, so talking about this hackathon, leveraging innovations to achieve sustainable and equitable healthcare, what does it speak to you?
I have seen since the the summit, clinic summit event, I have noticed that there is. I want to emphasize on NCDs because normally NCDs are sometimes they cost too much money for people who are sick for them. So we can we stop? Is it early?
Okay, it is well, but you could still feel free just to tell us a little bit, not a detailed part of it. Yeah, just in simple terms, you could just tell me something about this theme of this year.
So about this theme of this year, to get equitable healthcare, it means that you must have access to universal health coverage. So if we don't attend the universal health coverage, we cannot attend this theme of this year. So that's why I encourage people, government, so that to put everything so that we can get universal health coverage work in our countries.
Okay, talking about our countries and talking about the low resource settings, we are also seeing Burundi as part of this, right?
Yeah.
So what could be the loopholes in your health system as Burundi that you could share with us?
The response that can help to achieve.
No, the loopholes or the health challenges within your own nation.
The local challenge. So I have seen that there is many people are not aware of those illness, and they don't prevent, because we have to emphasize on prevention. And also there is the implication of the government and the Ministry of Health in our countries. So the main problem is
They could, yeah, the English, I get it, and it's just because maybe it hasn't been your thing, an everyday thing, but feel free, we are well.
Okay. So we have to engage our government so that they take all the decision so that we can get that access at universal health coverage, because normally some people don't have insurance, because insurance is one of the which can help to attend that universal health coverage and to access at equitable health care. So you can find people drinking alcohol every day morning, but they cannot access to health care. So I encourage them to, our government maybe to instaurate an obligatory insurance, a health insurance, so that, because people can afford beer, but can forget to to buy insurance so that they can get healthcare they need.
All right. Okay. Thank you. Thank you so much for sharing. And it is always well. He talked about insurance, and I feel like this is a to-do thing for every country, if I can say so. If at all, maybe your government could incorporate everyone paying just a small fee so that they can be able
Yes.
to access insurance at the end of maybe 1 year and stuff
Yes.
like that. It would be better.
Normally, there is an insurance, for example, for our country, there is an insurance which is there, but it's cost a few. The cost is not huge, but people don't go to and buy for it. That's why I told you we have to obligate those people to, because they can buy beer, then can also buy health care.
All right. Thank you so much, Doctor. See you around. Thank you for your time. Yes. Oh, you had it right. He was talking about insurance being one of the biggest challenges, especially in their country, that is Burundi. And he is from the University of Ungazi in Burundi, yes. So I think this is a challenge even here because, yes, many Ugandans here do not afford medical care most of the times. And I feel like maybe if it was accessed by everyone, we wouldn't be having these mortality rates that we are having in Uganda at the moment due to issues related with accessibility and affordability of the medical care. Here is another lady seated right here with me, and she is all the way from Kampala to Mbarara at Camtech, still on the issues to do with leveraging innovation to achieve equitable and sustainable health care. Miss Nambobi Olivia, you are live at AET TV. Good morning.
Good morning.
Still a morning?
Yeah, it is still morning.
Okay. I could ask, which field do you work in so that it can guide our discussion?
Oh, I'm working with the Institute of Information and Communications Technology, where technology is a solution to each and every, sector. And actually these days, without technology, there is no way you can be in position to move things. Basically, my area of interest is records and information management. And here with me, I have the hackers who have come up with a very good project. Their focus is on electronic records management system for cancer patients. During the time of COVID, we realized so many patients had to move miles to access the services for cancer. And at times, they even failed to access the services and they scammed to death. But right now, the hackers are here. They have developed a system which is going to address all those challenges. The cancer patients will access their services right away from the health centers up to the national referral. And it wouldn't, you wouldn't mind where you had moved from, because what we are trying to do is that in every direction you move, you'd be in position to access the services.
So how are they accessing the services? Are they putting a bus on the road? Are they creating an app that will always remind them that you're now going to Mbara to pick your medication? Which solutions do you anticipate from these people? And also, as a mentor, you've talked to them, you already know, but you could share with us.
Okay, we have come up with an electronic records management system, which has captured, we have integrated it with the NIRA, whereby you can be in position to use your NIN number and you can access services from wherever you are. Yes.
So, according to you, as a woman, as a lady, maybe as a mother, I do not know. I do not want to jump into your personal space. Oh, you are a mother. How do you rate the women in technology, and why do you think it is important for women to join technology and innovation?
When you talk about technology, basically I have seen a number of women, number of people who have engaged into technology. I see technology coming from down, from the grassroots, from the farmers, back to the business lady, back to the to hospitals, back to all industries. We are using technology, and when you look at women right now, technology has done a lot for us. How we can access services via technology. We can be in a position to research and find out more about us, via the IT solutions. So in short, IT solutions has been the robust to us. Yes.
Thank you so much, Miss Nambowi. See you around. Yes, that is the person from the records. Yes, and I think she has worked in this department for quite a good time, and she could be the right mentor to the people on such a project.
You're watching a Hit TV, empowering you. 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 You're watching a Hit TV, empowering you.
Just one eye at her, you can smile because of her beautiful smile. Hello, how are you?
Fine, how are you?
I'm good. Sharon Ashaba from Camtech. So, at the event, you are an organizer or?
Yes, I am. I'm part of the 9th annual Camtech Uganda Medtech Hackathon, and I'm part of the organizing team. And I also work as the marketing and communications officer at Camtech Uganda.
Tell me the secret behind your smile.
Oh, I actually don't know. I'm just like this. I was born like this.
It is therapy to most of us here because every time we just turn around and we look at you smiling, you're like,
It's actually a trademark. It's a trademark. Yeah, you need to smile to look more young. So you can actually tell. You cannot. I'm pretty sure you know to guess my age. Yeah, I'm just kidding.
And indeed, I don't know, and I will not ask.
Okay.
So with Camtech, how long have you worked with Camtech? Is this your first hackathon to attend?
Actually, this is my second time attending, and part of the organizing team was for Camtech Uganda hackathons.
Okay.
Yes.
This year and the previous year, how do you rate? How do you gauge the two hackathons?
Actually, this year it is more engaging. This year we have more mentors. I'm happy that we have more mentors than last year. Yeah.
So according to you, are you an alumni for Alluminus? Yeah, for MAS?
Yes.
Had you ever participated in such a...
Yeah.
Why?
No. I think I didn't know about Camtech by then. Yeah. Yes.
So partly you didn't know about it, and then later you joined. I thought that people who join are actually just alumni. They just upgrade to Camtech.
I actually came at Camtech as a volunteer. Yeah. So I came to know about the hackathons through when I joined Camtech.
Okay.
Yes.
Talk about the event.
As you can see, the event is just engaging. It's just, it's nice. It has very many people from different institutions, starting from the mentors, going up to the students. You have students from Moni University, you have students from Lira, Ambara University, Kavala University, and Mengo. I've seen some people from Mengo. Yeah.
Okay. So for us, we have our own picture of what we are seeing right now. But you, as the organizers, you know the deeper part of the organization. Is everything working as you expected?
Yes, we expected to have this kind of hackathon this year. So I'm happy that what we prayed for has come true.
Okay. Thank you. That is Sharon from Camtech, and she says everything is as expected. Good morning to our viewers. This is Bridget, and we are live at AET TV, empowering you. Yes, the Medtech Hackathon is here, and so is the judges who are ready to judge, and we shall be able to give you the winner of the day or the winner of the 3 days. Yes? Okay. I'm going to start.
You're watching AET TV, empowering you. You're watching AET TV, empowering you.
Good morning to our viewers.
You're
This is
watching
Bridget,
AET
and we are live at
TV, empowering
AET.
you.
You also need to listen to him because he has a package for us all the way from America. He is a master's student in America. So, Mr. Kartik, you could tell us, who is Kartik?
Sure. So, hi everyone. My name is Kartik, and I'm from India, but I've been studying in America for my undergraduate and graduate degrees. So currently I'm completing my master's in learning design and technology with a focus on artificial intelligence and learning.
Why do you think it is more important to integrate AI in business, in medicine, in every aspect of life?
Yeah, so artificial intelligence is probably going to change everything around us because it gives us the ability to access knowledge very quickly and also gives technology a way to analyze that knowledge and give us feedback, right? So for example, in education where I work, artificial intelligence can help you personalize, it can help you democratize and increase access, and it can make the process more engaging and fun. Then with businesses, you can reduce your costs by integrating AI in every aspect, and then the human labor will focus on the more important things that are to deal with the business.
Okay, so right here, we've seen people getting into business, others getting into technology-related business. How does technology come to be a business?
Yeah, so I think there've been a great set of ideas here, and students are really working well in their teams to solve a lot of medical crises that are happening in Africa. So the way you look at technology is that it is supplementing the whole process. It's not replacing it, right? So one great thing here is you've understood the role of both the doctor and the technology, or the service provider and the technology, and seeing how the technology helps the service become better. So what technology can do for you is help you reach more patients, reach more people, and reduce your costs in your labor.
So, as a master's student that has mastered the art of technology, are there any innovations that you have been doing so that maybe that you would love to share with us?
Yeah, personally, I'm working on building a culture of integrating artificial intelligence in education and seeing how countries in the global south, so countries like Uganda, India, Bangladesh, countries in Latin America, South America, how they can start using artificial intelligence to improve educational outcomes in their schools. So right now I'm working with Camtech to see if we can integrate AI in MUST, and I hope by the time I leave it's successfully implemented.
So, how long are we having you here?
I was initially planning to stay till December. I came in September, but now I'm considering staying longer through next year.
That is amazing.
I might be here for a large part of next year.
So, does it mean that you are embracing the ideas that your participants are presenting to you?
100%. I think there's a great potential in the students here, and they are very motivated. It's something you don't find in many other countries, where students are focusing more on the problems than on making profits or earning more money. And I think that set of ideas can help places like Uganda, places like India, where I come from, a lot.
How do you rate the participants according to their innovations that they are presenting? How do you rate them? Are they going to solve challenges, or are they just simple innovations, or they are doing great?
No, I think they're deep innovations.
I'm with another mentor, and this is a mentor in AI and business. You also
sitting there for hours in the cold. Patience is a virtue till we die. Then a ripple in the water caught my eye. Sometimes we don't know what we're waiting for, and that's the time to be the first one on the dance floor. We go from green to blue to gold to black. Breathe deep. Who knows how long this will last? Only was last week I learned to drive. I stole my mother's keys and drove all night. Christine never showed, it's 4 a.m. I started up Mom's car, drove home again. Sometimes we don't know what we're waiting for. That's the time to be the first one on the dance floor. We go from green to blue to gold to black. Breathe deep. Who knows how long this will last? One year ago, I've kissed
If you have things to present, it's best to be in the center. For the finals, we'll be a bit more off-center because of the projector, but it's important to be right here with the judges, okay? And also, can I have Toto Warmer? This is how we're gonna do it. Where's Toto Warmer? Please come on this side. I'll have you come over here. This is what we call waiting in the wings, being prepared. Okay? If your team is on that side, we'll have you go around through the back. If your team is on this side, come up here. We want you to be waiting in the wings. This, we learned 3 years ago, really helps move things forward. It cuts down 1.5 minutes. Minute, 90 seconds. 90 seconds. I'm doing the math. Alright, so you guys are ready? Are you guys ready? Timer. We're about to start. Ready? Go!
Biocare. Imagine as your sister, friend, or neighbor who is pregnant and perhaps they are facing violence cases and they are at risk of losing this pregnancy. You as a person, what can you do to help them? We came up, according to research conducted by WHO, we find that that is 5.9% of all violence happen in women, while 13.9% of these cases, they affect pregnant women. Out of that 13.9, 12% of this basically cause implications to the women. And we as some of the institutions we looked at the current methods we have in Uganda is reporting to police, which is not effective. And we also have places like UNICEF, which have developed a report. I tried using the system, but it's unfortunately very slow. As BioCare, we came up with a solution. And the solution is using a USSD. We find that we have pregnant mothers and VHT. VHT, this one, they handle counseling and health education to the mothers. Now, before any report can be taken, they try to solve these cases here. In case they fail and it's out of their hand, it's a bigger problem, then they can use our system by using the USSD. And on this system, they can be able to report crime. When they report a crime, they can send an audio at a toll-free, or they can send a message, which goes to the service provider, and the service provider sends the message to the CSO, where here most of the cases are handled. The CSO then interacts with the victim, and the interaction, they try to sort out the cases before they can go further to the police. If they fail and maybe the husband still continues mistreating the wife who is pregnant, then the authority handles that. And sometimes the authority can be infected. And that's why if the authority fails to take action, then the CSO who are more educated and have the legal actions, they can be able to report the cases and open cases to them. On our business model, we have our partners, as you can see here, those are the partners, while our main customer is the CSO, which we have there, and the organizations we are going to sell this data to, which we record. And the end users, we have the pregnant mothers and the PHT. While the cost of this would take approximately 18 million to use a shared USSD code. And this method is very efficient, flexible, and cheap. Thank you.
Well done. We've got 2 minutes. Questions and answers. Go ahead.
Yeah, you said the audio is all free, whatever the SMS.
The SMS also is all free, and the reason we did that is because these people here, sometimes they work voluntarily. So the cost will all be incurred by the CSO. They are the ones who are going to register this code, and these people, they can educate them on how to use the codes for free. And here includes some NGOs like FIDA, UONET, among others.
And then next, the authority. Who is the authority of
The authority can include police, whereby if the CSOs report to police before taking any action, then police are supposed to take the legal action required so that either these people are brought to justice who mistreat their wives and cause them to lose pregnancies or any other consequences due to lack of pregnancy. But if they fail, then we have the CSOs who come, they have a team of educated people, and these NGOs, they have legal advisors which can take the case further and be able to bring justice in case all means don't work.
Can you explain how you came up with 18 million for the cost?
The 18 million basically comes up because when we were doing our research on the USSD, we find that to register a USSD, and it would cost approximately 20 million. But this 18 million, we find that they are shared USSD codes, which is an approximation also. So it means that as much as the CSO can come in and attach the USSD.
Great job, back to your pitch in 3 minutes. Come on, you can go ahead and have a seat, thank you. That's BioCare, everybody. Well done. I'm actually, the judges are right here in the front, and these guys did a great job with volume. So you can hear, we're going to go ahead and add a mic. They were projected quite well, so I'm going to give you this mic for later. It has an on and off switch. And then now, up, Toto Warmer. I'll hand you the mic in a second, just so we can make sure the teams in the back can hear. And up in the wings, can I have Save Neonates? Who's there? You one. That team. Can you come here? Make your way. Now, for those of you who are running software Arduinos or bread boxes, if you have a little bit, breadboards, boxes is different, but if you have a little alarm that's going off, please try to shut it down, because that happens during these times, actually. So I can hear them from time to time. So just guys coming up. Who's taking the mic first? You ready?
Hello, this is Team Totowoma. We are producing a low-cost garment to prevent heat loss and provide adequate warmth to prevent hypothermia and other infections. So currently, mothers use lesus to insulate their babies from the cold temperatures, and this warmth is not sufficient enough. So what happens when they use these lesus? You have the babies getting hypothermia and other infections such as pneumonia. UNICEF has documented that 15% of babies die due to pneumonia infections. Our solution is very simple. We designed a double insulated garment. So you have a zipper here, you put foam to increase insulation, and at the front, we have a provision to also provide kangaroo care, so the mother and the baby can have skin-to-skin contact. We also have straps for support. So the materials for this product are mainly cotton to provide warmth, and then we also have material on the outside to prevent heat loss. Our technology is unique in that we're not using technology, we're using locally available materials. It is long-term, we don't have to dispose it off, you can use it again, and it's not restricted to only being used in the hospitals.
On the business side, we have an estimation of the cost of production that is 1.5 US dollars, that is something like 5,000 Ugandan shillings. We shall sell at the US dollars 3, and that is something like 10,500 shillings, and that brings us to a profit of 1.5 US dollars. Our market, we aim at selling our product to the government of Uganda through a market requirement. so that whoever is going to the hospital, these pregnant mothers, they're required to
It is day 3, yes, and the final day, the main day for the pitch sessions. And here we are, still at Mbarara University of Science and Technology at this grand event organized by Medtech Uganda in partnership with Mbarara University of Science and Technology. I see very many partners around here, people from NITA Uganda, people from IFPMA, yes, people from the Ministry of Internal Affairs, is it? Of ICT and National Guidance and Massachusetts General Hospital and very many other partners. We are here. But yes, I hadn't had someone from the medical field talking to us, and here he is. He is Dr. Andrew. Yes, Dr. Andrew, and he is from Mbarara University of Science and Technology as well. He's a researcher and very passionate in mentoring the youth or the young people into medicine. He will say it himself. I do not have to talk on his behalf. You are live at AET TV, Doctor. Good afternoon.
Good afternoon. Thank you so much for having me. Yeah, it is a pleasure to be part of this event. I think Camtech and the hackathon is an opportunity to modify our future, to make our future better. I have been glad to interact with these young minds. And you know, they have always described Africa as a low income setting, low resource setting, But having interacted with these young people, I have come to learn that we are actually not a low knowledge setting. These young people are brilliant. And for me, I am so excited because all the innovations here are in my field. They're innovating in health. And this is very beautiful.
How can I tell that a country is a low resource country and this is better than the other?
Yeah, well, people use something called GDP, gross domestic product. I am not a finance expert, but that's what they use. But I believe that because the people have knowledge, and now opportunities like the hackathon are letting our young people translate the knowledge into technology and innovations. I believe this actually might sell out to be either eventually transition to a better income country. Because if these innovations can be sold even to other countries, I believe they could bring in revenue for a nation.
So as an expert in the medical field or as someone who has been working or dealing with issues to do with non-communicable diseases, I want you to tell us about more of the health challenges that have been transpiring, maybe because you have worked on this for long, so you could share with us in our own health system, what are these health challenges that really need a quick response or an immediate response?
Thank you so much. Non-communicable diseases are growing in our community. And unfortunately, because we have been used to communicable diseases like HIV, malaria, and TB, we have not been ready for non-communicable diseases. And as you can see, usually people think non-communicable diseases are not a big problem because they look at it in a way they are focusing on traditional risk factors like smoking, physical inactivity. But we have new risk factors, things like air pollution, the bad air that we breathe in that comes from all these cars on the streets, the borders, the smoke that comes from our kitchens. And also things like lack of sleep, for example, could actually cause people to develop non-communicable diseases. These challenges are pertinent, and I'm very happy that through the hackathon I've seen people trying to develop innovations to reduce air pollution. We still have challenges in screening non-communicable diseases, for example. People cannot easily access equipment to test for diabetes, for example. Low-cost equipment. And it's beautiful that this hackathon is actually encouraging the youth to look into low-cost things. I can tell you, if I need a machine to diagnose diabetes, I have to import it from China or other countries. We do not have a Ugandan-made machine that could actually diagnose diabetes.
Do you think we are still low at thinking or at designing an innovation, or what's the problem? What is causing?
I think our people have the knowledge, but they have been lacking opportunity. And I am happy that the hackathon brings people from all backgrounds, from health, from technology, from business together. And that is an opportunity to share knowledge and create solutions that can bring in money, but also, give us, a leverage to tackle our local problems. Yes.
And that brings me to another question, which is in regards to the theme. So, how can we leverage innovations to achieve an equitable and sustainable
So it stems in the word equitable. So equity comes from fairness. You don't give everybody a bicycle. You give each according to need. And the beauty with locally generated solutions or locally generated innovation is that they will solve the problem in the compound. The problem here, because I can tell you, if I want a machine to save life and I have to import it from China, it takes time to reach here. But if I find a machine already made here, It means that it is going to save me the shipping cost. It is going to save me the shipping time. And I believe it will save life sooner than the one that we have imported. Yes.
You're talking about importing. People are developing ideas here, solutions. But yes, people have been developing solutions. We have existing solutions which are still having loopholes. How do you think we shall bridge that gap that is there?
So, research is the answer. Yes. We research. We look at the current weaknesses and then use innovation to bridge the weaknesses. And I think this is what is happening here. That these people who are here are researchers in different areas, and they have come in with problems, and Camtech has given them an opportunity to sit together. You know, networking is actually a mother of innovations. You know, because I can be locked down in the hospital with my problems while actually not knowing that a biomedical engineer already has a solution. You know? So networking is actually the mother of solutions, you know? And this is the opportunity that Camtech has brought to us. You know, I would never have met a biomedical engineer actually if I didn't come to Camtech.
Really?
I've always I've been in the hospital in my ward. I rarely see them, you know? I have had an opportunity to meet people who deal with artificial intelligence. And it's beautiful to learn what they are able to do and how it can help me in my work as I treat patients.
As you've said, you've always been in your hospital. And I know within the hospital, there could have been, I could call them challenges or the weakness, the weakest points of maybe that system where you are working. I would like you to share. Are there some of the things that you would have wished to be addressed by these innovators today so that they could be able to solve the challenge that you are already seeing at hand within the hospital?
Thank you so much. We have very many challenges, but maybe to mention a few. One of the biggest challenges we have is actually record keeping. I can tell you that we are struggling. We are still writing. I don't know if you have ever come to our hospitals, but when you come, we send you to go buy a book and a file. You know, and we shall use that book you have bought to write what our diagnosis and our treatment plans. But these books can be burnt by fire. Rain can wash them away. And it's beautiful. We need a medical record system. But we don't just need a medical record system. We need a medical record system that is usable, easy to use. Unfortunately, most of them that are available come from abroad. And they are not contextualized for our society. And sometimes they are very cumbersome and time wasting. And I'm glad if from this hackathon we can actually come with a local medical record system that can be used easily. That will be a lifesaver. And two, we are still struggling as far as medical equipment is concerned. That's a problem really that needs to be addressed. And as we say, we are looking for low-cost equipment. For example, every person with diabetes needs to have a glucose monitor. How will they get it? You know, I will be happy, and my mother in the village with diabetes will be excited if she hears that Mbara University has generated a low-cost sugar monitor that she can actually buy. You know, it's you know, we have, this is an opportunity actually to answer problems that I like calling them household problems, because diabetes is going to, if it keeps growing at the same rate at which it is growing, it will reach every household, you know. And that's why I was encouraging the young men here, the young innovators, young men and women, that they shouldn't be worried of market, because our people are growing older. And you know, non-communicable diseases actually are most common in the elderly people. Yeah, and I'm telling you that every old man will need a glucose monitor. Every old woman will need a blood pressure monitor. And if we can innovate local blood pressure monitors made in Uganda and more so in Bara University, we will have not only solved the problem, but we will have created market for ourselves, you know.
As we had already said, that these are the low resource setting areas that we are talking about. Will our people be able to buy the glucose?
As I said, we are not a low knowledge setting. And knowledge gives us an opportunity to develop things in with low resources, you know. And that's what entrepreneurship is about, is that you will actually look for better ways of, you know, producing something at a low cost, you know. And if we are going to stand by our theme, whatever we are developing here should be affordable. Yeah, because most of our people are not very rich. But I believe that when we put our heads together, knowledge and research, local research, we will actually get something that is not expensive, but is able to solve our current problems.
Wow. He has said a lot, and hopefully this will be able to address the challenges within the health sector. I do not know what is in your hospital, but he gave us the information in regards to his own area, where he works, where he stays, where he has worked with very many people, and he's very well conversant with what is transpiring within the health system. Thank you so much, Doctor.
You're most welcome.
Okay.
It's a pleasure.
All right, thank you. We are still at the 2023 Medtech Hackathon, and this is AET TV. Do not go away, just stay on. You will just be watching some of the highlights of the previous hackathons, that those are maybe, yes, 2016, 2022. You will be watching those highlights as we get back on air.
Is getting hypothermia and other infections such as pneumonia. UNICEF has documented that 15% of babies die due to pneumonia infections. Our solution is very simple. We design a double insulated garment. So you have a zipper here, you put foam to increase insulation, and at the front we have a provision to also provide kangaroo care, so the mother and the baby can have skin-to-skin contact. We also have straps for support. So the materials for this product are mainly cotton to provide warmth, and then we also have material on the outside to prevent heat loss. Our technology is unique in that we're not using technology, we're using locally available materials. It is long term, you don't have to dispose it off, you can use it again, and it's not restricted to only being used in the hospitals.
On the business side, we have an estimation of the cost of production that is 1.5 US dollars, that is something like 5,000 Ugandan shillings. We shall sell at the US dollars 3, and that is something like 10,500 shillings, and that brings us to a profit of 1.5 US dollars. Our market, we aim at selling our product to the government of Uganda through a mama kit requirement, so that whoever is going to the hospital, these pregnant mothers, they're required to come with the mama kit, and that is where our warmer is going to be. And then we are partnering with the government, that is Ministry of Health, and the USAID rights. And then we have sustainability, whereby our materials are readily available in Uganda. Cotton is produced here in Uganda. This zipper was actually made by a Ugandan. And then feedback, that is social sustainability. We have something here, like a piece of paper will be put inside in case someone wants to know or give us feedback. And then we also have income from sales. Of course, as more income comes in, we shall be able to sustain our project. And then Durability, this cloth is actually washable and it can be used over and over again. The next childbirth, and the sizes actually vary, and that gives us a better advantage. Our team is composed of clinicians, business personnel, biomedical engineers, and medical consultants. Thank you so much.
Well done. Well done, guys. 2 minutes for questions.
Thank you very much. Good job. You're carrying a mother to carry the baby on the front. Our tradition is carrying at the back. What services do you think that might bring?
Yes, allow me to answer that. We've made it in a way that you can carry either in front or behind. And these are the, she can just show you. Because we understand some cultures would not easily accept that. Thank you.
So actually, great job. So for the pricing, so you guys said 1.5 US dollars.
That's the cost of production.
So you guys said you're gonna sell it for $3, right? Or $3 US. What is the, if you guys calculated the estimated number of models by per year, 2 years? How much your projection you guys?
Well, this is something you're going to buy at once because you use it over and over again. You're not going to incur that expense the next time you're giving birth. And of course, with the Ministry of Health putting it in the mama kit, they're buying from us but giving to the people for free, just like you have seen them distribute mosquito nets.
But asking for the total budget, have you guys calculated the number of moms by estimate number of moms who need this? It seems to be number like 1,000 women will need this for year 1, 2,000 women need it for year 2. I want to get like a total projection.
We're estimating in a year 1,000 women could actually use this. Although we have a plan that after 6 months we intend to reduce the cost so that the price can actually come down. It being the new project, we are still incurring the cost, but later on it will lower down.
My question is on your product. So why don't I just start my mattress? Create your solution.
Good afternoon. So this is neonates, which is abbreviated as SNETs. The problem here is one, death of neonates. 20,000 preterm babies are born in Uganda every year, and 62,000 of them die. Why do they die? They die because they don't have an appropriate environment and they have very weak immune systems, hypothermia, and they also get infections. So, what is the current solution that is battling this? It's an incubator, but an incubator has so many bad sides to it. One, it is quite expensive. Two, it is complicated to be used by the professional, by nurses. Nurses don't know how to use this instrument. Also, three, it's hard to maintain. So we came up with something which is called a SNET that helps, it is going to help preterm babies. What does it do? One, it does the basic. It provides warmth using a ceramic lamp, a 75 ceramic lamp specifically for warmth. And then it has a filter made out of zeolite, so it requires less pressure. So the filter is attached to a motor which has negative pressure. It pulls in the air, and then it comes out, it's humidified, then it goes into the baby chamber, which will be right here. Then the third thing, it has a temperature sensor. The temperature sensor keeps on monitoring the baby's temperature. If the temperature goes out of 36 to 37.5 degrees, it will display on the monitor and also make a buzzing sound and the red light for the deaf people. Also, this is the material used here is plastic, and this is PVC, waterproof PVC, so you can easily adjust its size and inflate the mattress to whatever size you want. Then the business model, that total cost, the most expensive thing here is the battery. We're using a 100-watt battery, which is $200. But everything else is quite cheap. So if you look at that, total cost of production is $260 US. That is the total cost of production. And if you want to make a profit, you could add in $40 to make it $300. That is 20% of the original the low cost of an incubator, which is 1,500 US dollars. The market, basically, anyone with a preterm baby, you can think of very many people, clinics, mothers, daycare centers. It's not only for people for preterm babies, it can also work for the normal babies. Okay? It's basically anyone with a baby can use this. Yes, and that is basically it. This is just a block diagram of how the electric circuit works, right there. And this is how the block diagram of how the oxygen supply works. Thank you so much.
Well, remember, I need to see the design. The person who is monitoring the baby inside there, where do they see the baby from?
The electric circuit is fitted with an LCD display panel. So it keeps on showing the number of degrees. This is also transparent and it's zippable. You just zip it. The actual material is supposed to be cloth and plastic plus waterproof PVC.
So you said this would cost $300. How will pay for the $200? You said it cost $300, right? Who's paying for that?
Who is paying for the $300?
Yes.
Thank you very much for the question. Most incubators are bought by hospitals. The organizations that supply the hospitals with incubators or donors. So if they have a cheaper device that is even portable, they will go for this because it is cheaper than the other bigger incubators, and you can buy more. Like this is 20% less the cost, meaning you can buy 5, you want to buy 1. So you buy 5 and take to the hospitals, clinics, all those.
Okay, you mentioned anyone with a preterm baby as a customer. Is it advisable for a mother to treat their kid?
It is not advisable, but however, in Uganda, for example, Bara Hospital, they have space for how many babies? 20 in the whole hospital. The prenatal intensive care unit is 20 babies. So some not so delicate cases can be sent at home. So if your baby has a problem, you can easily call the doctor or move to the hospital. Instead of making the baby sleep on the cement, you take him home and put him in this, and it is fine. You're not treating it, but you're giving it the conducive conditions.
These are the group members, and let's go to the slide. The maternal mortality rate is high in Uganda, and this is because of these challenges that we're seeing here. It's because of inadequate healthcare information that is provided to mothers probably before and after giving birth. And then also it's because of the poor follow-up and poor interpersonal communication between the doctors and probably the mothers. The government are trying to solve this problem by coming up with village health teams and then community health workers trying to help these people out. But then this is seeming not to be so effective, though it is doing something, but not so effective. These village health teams, some of them actually, these people who do this training, don't have the skills of doing this training, and then they lack some of the information that's required to do this. Then again, there is limited interpersonal reach out. They cannot reach out to each and everyone in the communities. And basically, we've come up with Mama Care, and Mama Care, basically why we come up with this, it's a mobile, it's used on mobile phones, and why we came up with this, according to the statistics, 17 million Ugandans are having mobile phones, and it can be used on all types of phones. What is Mama Care? Mama Care is an information it's an innovation that is accessed through unstructured supplementary service data, which is USSD, that allows you access accurate information about maternal health, allows you to get information about what to do with the child, when to immunize, and allows also you to make inquiries. In case the information that you need from this application is not there, you can ask a question and it is answered through SMS. Okay, this is what happens. When you press star 189, where we had made that as a sample, you're going to be brought to this, and you're supposed, if you've not subscribed, you subscribe, and if you've already subscribed, you access the services. Why Mama Care? It's cost effective in terms of transport because you don't need to spend a lot, and then it's mobile. Okay, let us take you through business.
For the business model, we're looking at subscribing for the application, and it is a cost at 500 shillings to subscribe for the services. And then, for the case of inquiries, that is the basic thing we're looking at. For every inquiry, for every SMS we send to you, it is at a cost of 200 shillings. So for every inquiry, for every message you get as a result of your question, it is charged at 500 shillings. And our key partners are having the telecom companies like MTN, the content providers were having the Iraq, for some, we're having organizations that are non-profiting to help us fund this project of ours. And basically,
Thank you very much. I have a question regarding the solution. How is this helping the VHT in their work or addressing that?
basically, you realize that most of the people do not get the information. They don't have adequate information. So it is better they get informed of this information to care for them before and after pregnancy. So that by the time you realize that most of the complications as a result of they are lately realized. So by the time they're going to the health workers, it is a lot of work that is deposited on that side. But if they're informed, they come at an early time, they know what to do and when to do it. It is easier to recommend better treatment or to recommend to diagnose their problems because they've been following, they've been reading information to guide them on how to stay healthy with their pregnancy. So it is easy for them. The work deposited on their load is less.
Thank you. How do you intend to get mothers to willingly subscribe to this, especially the also an additional cost? How will you find this?
Oh, thank you. We're already planning to use the same VSTs, the way they've been just moving to the population, telling them such services. We are also going to involve them so long as it's something that is going to improve their community they are in. We shall also use the same, because we are partnering up with the telecommunications companies, we can just try it because they can try to help us to advertise it. Thank you.
Have you guys looked to competitors? People are doing this.
Yeah, currently there is something they call it's a mobile-based application. It is currently in Tanzania, but the only problem with it lacks privacy. It also lacks confidentiality. Like people cannot really rely on.
The other thing is most of them are internet-based, so ours is not internet-based. It's a matter of subscribing to it.
Good afternoon. Globally, it has been reported by the World Health Organization that up to 26% of neonatal deaths are caused by preterm birth, 28% is caused by severe infection, and 23% is caused by asphyxia. And it's also been shown that these conditions are conditions that could be easily treated and early detected by the functioning of medical equipment in hospitals. According to the World Health Organization, it showed that 50 to 80% of medical equipment in developing countries is not working. And they also stated that the improvement of medical equipment maintenance and repairs helps in the improvement of medical equipment utility, quality of healthcare provision, and cost efficiency. They also realized that the causes of these breakdowns is the lack of skilled and trained biomedical engineers, the procedure delay in reporting of faults, and the discrepancy in the after-sales services provided by these biomed companies.
That's why we are planning to bring to a place a smart Medtech management system. The system monitors the health of the medical equipment so that it communicates with the biomed engineer to know when to do service, to know when to repair, to know when to know the location of equipment. How does it do that? It knows when the system is switched on, it communicates. It tells you when the medical personnel is infusing, like now they're doing a blood pressure, it tells you what the functionality is doing. And how do we bring this into place? We have managed to integrate a system which is used in GPS into the medical technology. because we realize the systems are already developed and it can be used to achieve this. So our business model is that we're going to provide this to the public sector, we're going to provide this to the private hospitals, and we shall own the equipment. Then we shall be charging retainer fees, we shall be charging them for service maintenance, we shall be charging them for the parts replacement, and we have the margins at which we are going to charge them. And then also the system communicates on an app and on an SMS. The SMS is the basic mode of communication you'll need in any rural area. You don't need a smartphone because there is no internet. So these Medtech engineers will be able to do all the monitoring and maintenance with just a centralized system. Our team is composed of biomed engineers, we have the IT experts, we have business, and we have actually students as well, because we want to groom them, and then we have the business experts.
Okay. Thank you for that presentation. Maybe I just didn't get it, but could you walk me through how what you're doing is related to the theme of neonatal and maternal health?
That's very good. Now, see, all these machines, the baby monitors, the oxygen concentrators are all necessary for the babies. However, when they break down, the scenario where mother walks into a hospital, the incubator is down, and the biomed doesn't know that baby is going to die. So we are basically, our main focus area is those machines that are used for babies.
Here I am with the voice of the innovations at Medtech Uganda and Bara University of Science and Technology. Talking about innovations, she appears. Good afternoon, Miss Nuriat.
Good afternoon to you.
Okay, Medtech Uganda. How long have you done this? How long have you been in existence? And why major or focus at innovations?
Okay, first of all, Medtech Uganda. Medtech is the consortium for affordable medical technologies. We do so many activities in terms of supporting innovators. One of them is the Medical Technology Hackathons, which is the beginning of innovations where people come together to brainstorm, to pitch challenges, form teams, and work on solutions, prototype solutions. It's a competition, and we have done this for the 9th time. So this is the 9th year that we are doing, we are conducting a medical technology hackathon.
They are 9 times. What have been the greatest achievements of Medtech Uganda for these 9 years that you have spent working on innovation?
We have supported quite a number of innovators, right from idea to prototype development, all through to commercialization. So whenever a team comes to us, we support them. We even support them with grant writing, and they win grants. They have competed globally, and they have been able to win funding that supports them to develop their innovations and even have them tested. So there are so many achievements. And of course, when they win funding, most of them end up getting, giving out jobs, employing others. So for the last 10 years, we have so far created job opportunities of more than 216 job opportunities for different, on different projects, innovation projects, and we work with a number of innovators. We support them, like the achievements are many. IP filing, some of them have been able to file for IP. Some of them have been able, like they have been traveling, they have become consultants. They are now experts in this innovations field.
Okay. Are there any companies that have come up with the support that you're giving to these innovations? Have they developed their own companies that are very big? Maybe you could also share which companies are they, if at all they are there.
There are companies that have spinned through our ecosystem. And we have a total of about 9 companies that have been formed. And of course, all of these companies are into health. There is one which is eWall, which is an application for supporting or providing support to low-level health workers in order for them to manage the newborns. Then there is MobiCare, which is an application that supports health workers and patients to link together and have appointments scheduled. There is Collard, where we started making a hand sanitizer called Sunny Drop. There's quite a number that I may not be able to mention now, but there are a number of innovations and companies that have been formed. And we are looking forward to having more and providing more support to more of these innovators that come through our hackathons so that they can have companies and build solutions to solve our local health challenges.
Okay, that is amazing and that's great. I will thank you for that because that is a very great effort and tremendous work that you're doing. But now there are 9 companies in existence. How many teams, according to estimation, have gone through your support or your hands as Camtech Uganda that maybe have engaged in hackathons? According to estimation, how many teams have you hosted?
There are more than 30 that have, okay, I'm looking at the teams that have been successful, develop products. But in hackathons, every year we have more than 30 teams form. Between 20 to 30 teams form. But of course, the consistency comes in post-hackathon. How determined are they to continue working on these solutions? Yes, but in our innovations lab, we have more than 30 innovation teams that we are supporting currently at different stages, of course.
Okay. In the lab that you are telling me about, how do people get access to the lab? Do they just come with the ideas? Is it through hackathons, or if at all anyone had an idea, maybe from MUST or from even within other universities, they could just come to test their is it an innovation or product? I don't know how you tell.
We work with quite a number of innovators from different universities. Like for this hackathon, we have innovators from over 5 universities across the country, but also outside Uganda. There are innovators who have traveled from a university called Ingonsi from Burundi. There are innovators from universities in Kampala and around in the Western region. Ankole Western University, there's MOOC, there's MOBS, there are so many, Kawale University, they are all here innovating. And when they get to forming teams, it doesn't matter what university you're coming from. They form teams like depending on the interest of someone. So you find a team has innovators from different institutions.
All right, as we conclude, kindly talk about the theme, why leveraging innovation to achieve equitable and sustainable health care.
We believe that everyone should have equitable health care. The healthcare system in Uganda and all over should be fair to everyone. The solution everyone should be able to achieve or to get the healthcare services that they require affordably and conveniently. As that.
Okay, thank you so much. So which kind of reward should we expect today? What are the awards? Or
we will have the first winner, the grand winner, the second and the third. So it's prize, it's just money, little money, but that's not the end of it all. Most teams come here to work and they are excited. So the little money we give them is a gift. It's just a gift, actually, that they can share. But post-hackathon is how resilient is your team in terms of continuing to develop the solution that you started working on during the hackathon. And from experience, we have seen teams that have not won here go ahead and won further funding. They have gone ahead and won, extra funding from other institutions and from Camtech, because there are seed grants that we give out every year to 3 teams. But most of these teams are those that come from the hackathon. Yes.
I just believed that the money that you give, the award that you give today is a startup capital.
No, it's actually a gift.
It's a gift. So where do they get the startup?
They choose what to do with the money, because after that we invite them and train them on grant writing and equip them with grant writing skills to be able to apply and compete for funding.
Thank you so much for your time. I know you are too busy. See you around. So thank you so much. That was Miss Nuriat, and she works with Comtech Uganda. And I can say the event has started. Keep on. It is Bridget and Cementa on AET TV.
We are also pleased to announce the presence of the rector, Gonzi University from Burundi, Father Apollinaire. You're most welcome. Our guest of honor for this evening has joined us, Professor Bazeo. We are so honored to have you join us this evening. Okay. Now, I'd like to announce to you our distinguished panel of finalist judges. From the Office of the President of Uganda, Dr. Cosmas. Thank you so much, Cosmas. From Barara University of Science and Technology, the Dean Faculty of Applied Sciences, Dr. John Sobongoloch. And all the way from Geneva and from the World Intellectual Property Organization, Ms. Nadine. From the Faculty of Business and Management of Mbarara University, Ms. Sarah. From the Faculty of Medicine, we have Dr. Andrew Mute Kanga. And from the Faculty of Medicine again, we have Dr. Biamokama Onesmus. So you've realized that it's a rich multidisciplinary team of business, engineering, and health. So, I would like, on behalf of Comtech Uganda and on behalf of all the institutions and our partners that have made this medical technology hackathon happen, I would like to thank the practice speech judges and also the semi-final judges for delivering us the products that we are going to see pitched in the finals. So at this moment, what I'm going to do is I'm going to announce the first team that is going to present and the team that's going to be on deck. Are we ready? Are we ready? All right, let me hear a drum roll. That sounds very hypoglycemic. Okay. We are going to do a drum roll for the first team that's going to be presenting. So can I hear a drum roll? Yes. Good. So, the team that's on deck behind the door is Team Mama Wear. So we would like to see Team Mama Wear go on deck, and Team Gesture Control Speech Assistant, you are on. So as you prepare to exit, you will have exactly a total of 3 minutes to present what you have been up to this weekend. And so you will have the 2-minute warning from Ms. Flavia, who is right there. Ms. Flavia, okay? After the 2-minute warning, you will be able to have the 1-minute warning, and then you will have a time up. And once you have a time up, please, they will clap you off. And when they start clapping, let everybody join in the clapping. Okay? And then the judges will have 2 minutes for question and answer time. So I'd like to see Gesture Control Speech Assistant right here, and Mama Wear, you are on deck behind. I want to see Mama Wear behind here.
Good afternoon. We are Team Speech Assistant, and we'll be glad to have your attention. So, next slide. Okay, stroke is one of the commonest diseases in rural Uganda, affecting over 14.3 of the people. So around 1 out of 3 of the survivors of stroke are unable to communicate with their caregivers, their clinicians, and this affects the care they are receiving and also affects them psychologically and mentally. Next slide. So the existing technology today only allows the stroke patients to actually type and be able to communicate with the caregivers and the attendants. But imagine if someone had a stroke and they survived and they're unable to move their arms, they're unable to use this technology. So the other fact about this technology that is on the market, it is quite very expensive, going for around 3.5. And imagine a man in the village who doesn't work but has got a stroke. How will he be able to afford this? So our team, Speech Assistant, has come up with a solution that is cheap, affordable, and sustainable. A software that will allow stroke patients to use their eyes to be able to communicate with their attendants and caregivers and also the clinicians, thus improving their quality of life. So what happens? There are a series of letters and symbols. The patient will blink and it will be able to say a statement that the patient wants to communicate. So my colleague is going to give you a short demo.
So these are our letters. I'm assuming that I'm a patient without I can't speak and I don't touch. So, but I need to communicate. I just look at the letter and then it speaks for me.
Because of complications coming from hypothermia. More than 60% come from low and middle income settings, sub-Saharan Africa and South Asia. This is largely due to the fact that such communities have lack access to sustainable hydroelectricity power, and also the devices that may be readily available on the market are quite costly, costing averagely more than $2,500. And there we have existing solutions. This is the high-tech infant warmer that costs $2,500, and that is the Embrace warmer, which has been an innovation that currently costs something like $200. But I promise you, our design is going to be much cheaper than that, only $30. And this Embrace also requires power, because this heating element runs on AC power from the hydroelectricity mains. So this is our design. What we have here is a chamber that has water underneath here. The water is heated by a 300-watt heating system that consumes DC power or can run on battery or AC solar power. So that means it eliminates the need for hydroelectricity power. So what we have here is our infant sitting, sleeping on top of a blanket that is conducting heat from the water down here. So we did some feedback, and we realized that we challenge with the humidity, and we have added a modification for a valve that will be letting out any steam that may be coming from the water. Remember that this water is at a constant temperature of only 70 degrees centigrade. We have a transparent cover on top. This is a transparent rapid prototyping, but we wish to have a transparent cover over the baby so that we can have constant monitoring of the baby. And I would also like to stress that this device will be used by a trained health officer at a health facility. And the business plan we have is basically we're going to wish that government or NGOs procure these units, about 3,000 health facilities in the lower levels in Uganda currently. If each can have one, that would be good. And we're going to have customer relationship in that we're going to provide user training and after sales service, and feedback from the customers will be used to modify the design. We calculated a break-even point. We are going to need to sell 30 units to break even. If we can sell 3,500 units, we shall make a killing. Okay, so that is our team. I'm the biomedical engineer.
Have you provided for ventilation for the baby?
Yes, on top here, are going to be holes for easy air circulation on top of this transparent shield.
Then also has your design accounted for possible heat loss from the heat source to the baby, and how are you going to prevent overheating?
We can take us. We shall have a sensor on the surface of the infant, so that if the temperature goes below 36, which is critical, then the automatic warmer here will turn on and make sure the water is at 70 degrees centigrade. If the temperature goes above the normal, then the warmer will be turned off. So it's automatic, self-regulating.
Have you looked at some of the thermal properties, like to heat water, how long it would take and how much energy it'll take, especially if you're using a light source to heat the water?
Well, the light, because of rapid prototyping, we couldn't access a heater, but we are actually using a heater. And on our circuit, we have a variable resistor. So our heater is, our water is regulated at 70 degrees. And then we make sure that insulation here allows only temperatures up to 37.5 to get to the baby if our heater is regulated at 70 degrees strictly.
I don't want to get out of my lane here, but with your, so what was the cost of production, including the sensor and
Referring to the business person.
Yeah.
We are going to have, as shown in the slide, we are going to have some fixed costs that we are going to incur, which include rent and labor. The indirect costs that change with change in the output. We have those indirect costs that have to do with selling and distribution, the mattresses, and then later on,
All right, well done, Team 54. Let's hear it for Team 54.
Decided to choose
every team that participated from the start are winners. Out of the 6, in fact, all the 6 are the best winners. And out of the 6, we chose 4 best winners. And my only work here is to present the third runners up. And this is my best team, Team 54.
Yes, Team 54, make your way right to that front. As the others clap for them and congratulate them.
The second runner-up is Team MBT.
Team NBT, quickly make your way up here.
Hard deliberation. We were also very excited about this project, designed to help get women back in the community safe and dry.
That he has done the Adaiwon dance. Yeah? Are we ready to hear the results? Are we ready for the results? Aye. Are we ready for the results? That's the attitude I want. I want to hear that people can hear. Are we ready for the results? Why are they only male voices? Are we ready for results? Okay. Allow me at this moment to invite the Vice Chancellor, Professor Kazova, Charles Tushabome Kazova, who will speak to us about innovation. Like someone described him in the summit, he's a father, he will encourage us. And later on, I asked him to invite our guest of honor, Professor Bazeyo, to speak to us. I'll task you to give a brief about Professor Bazeyo and why I'm praising him and taking selfies with him. And those photos are going to trend for Grant. He's a mobilizer. Professor, the floor is yours.
Yeah, thank you. Thank you, Angela. Professor Bazeyo, Nadine, who has just moved outside, Apolinar, he also has moved outside, and Cosmas, and the rest of us, ladies and gentlemen. There is the reason. There is the reason why you and me are here. A very important reason. When I try to reflect for the 3 days we have been here, on average, each of you has been here on average per day, about 8 hours. And if I make some slight adjustments, because when you are here and you come for a conference like this one, when you are moving, you talk about Camtech. You talk about the conference, even when you are coming. So I just made a slight adjustment add on that particular time. And that slight adjustment, I had to factor in 20% of the additional time when you are not here. So it means on average, if I put there 20% of the 8 hours, it means per day you have been here for 6 hours. For 9 hours, 9.6 hours. So it means for the 3 days, you have been here for 29.8 hours. And when I look through this room, roughly I can estimate probably we are 140 or 150. And if I make an average of that, I get 145. So it means on average per day those who have been attending 145. So when I compute the total number of hours, each of us combined or aggregated, we have been here for 4,176 hours. You can imagine you and me to be here to bring all our CPUs, and we sit in this room for 4,176 hours. There is the reason. The reason is very simple. We have been here to discuss issues pertaining to solutions that will solve the healthcare system in this country, in this region, and in the world. Therefore, I need to thank you for the time you have spent, for the good time, by the way, you have spent here, tailored solving the challenges we face as a country, as a region, as the world, as far as healthcare is concerned, and for coming up with innovative solutions, and I need to thank you. That's my number one. Number two, our Vice Chancellor, who is the best referee, would have been here, Professor Celestino Boa, is not here, so I'm standing in for him. So we also need to thank him. By the way, for the 9 years Professor Celestino Boa has been in this university, as far as research is concerned in this institution, for sure it has been increasing. And that's because of his excellent leadership. And we also need to thank him. My third comment, as I conclude, because mine was to invite Professor Bazeo to talk to us. There are 3 words, very powerful and very important words, which I like talking about. One word is business. For example, these innovations that have been presented here and those that didn't even, where they didn't present. The reason why you are coming up with an innovative solution, it's a business on its own, but at the end, you are looking for some monetary value. But if, for example, you are not looking at that aspect, probably, but that is the business. So in other words, business is one word. Another business is finished. Then another word is unfinished. Those are the 3 words. But once you combine them, you get 2 statements. You can say unfinished business, or you can say finished business. 2 important statements. Let me share with you my own story. When I did my primary, you can imagine P1 up to P7. At the end of that level, of course, I wrote examination like the way you did. And I was admitted in a secondary school. So my first months in secondary schools, I was talking what had happened in primary. talked a lot about what had happened in primary, but very important. I had finished my primary level, which was the finished business. But again, my primary level, which was the finished business. But again, there was also another finished business, which was my secondary level for the 6 years. Now you can imagine, even in secondary, again, I started in year 1, senior 1. Remember, primary, I started in P1. I finished A level and I went to the university, like the way you did. When I went to the university, again, this is what happened. The first month, I was talking about what happened in secondary, but very important, very important. I still had to do my bachelor's degree, meaning that I had finished my secondary, but I had an unfinished business for my university education. I can go on and on and on. But again, when I joined the working environment, remember, for the other 3 levels which I explained, I would start 1, 2, and onwards. But again, in the university, for example, like at Mbara University of Science and Technology, I've been here for 34 years. But again, when I mention 34 years, don't say this is an old man. I'm only 35 years old. Now, the point I'm saying, for the university here, now they do not count my primary, my secondary, or even my university education. They start saying, hey, how long have you been working for Mbara University of Science and Technology? They again start with 1. So why have I told you this, please? Those 2 statements, very powerful. Finished business and unfinished business. For these innovations which have been presented, remember, some of you, for example, you are in the pre-lab. That's the level where you are. Others are in the lab. Others are in the post-lab. But very important, whichever stage where you are, let it be pre, let it be in lab, let it be post-lab. Very important. Mark the 2 statements. If you are in the lab, it means, now, since you are in the lab, you finished the pre, now you are in the lab. Now, remember, there is the post-what? Post-lab. You have completed a certain business, you are in another business. Now, mark the following, please. For these nice presentations which you have made here, assuming you are number 1, that is a finished business. Whether you are number 2, whether you are number 3, and the rest. After all, Dale Carnegie says the following: success is never ending and failure is not the end. Now, the issue is that you have your unfinished business, but I believe these important innovations, can you kindly take them to another level that becomes, from today, your next agenda? In other words, you have got an unfinished business. Now to undergraduate students and others, please. When you are on the streets of Mbara University of Science and Technology, you are in another university. Please, if you are going to the library and somebody is trying to pull you back not to go to the library, simply whisper to that particular person, remember, I have got an unfinished business. That is my education. With those many words, ladies and gentlemen, of course, Professor Bazeyo, you don't need to be introduced. Just go to the internet and you simply put there Bazeyo. His name will come out. As far as innovation is concerned, and we need to thank you, for example, attracting, is it 30 billion to the university? We had to make noise as institutions, and we ended up getting 1 billion per year. It's because of you. And I am told, the story is told that you got that amount of money when you were on the plane, I think, going to America. This is what I had. The point is that Bazeyo has been behind the innovative agenda of this country, the innovative agenda of public universities. And for your information, Professor Bazeyo is an entrepreneur, is an enterprise. In other words, what he teaches the students, he teaches in the university to others, he again applies. that particular agenda. And we need to thank you for being an example. Thank you for not only being a professor by name, but of course by being a professor in action. And that's what we are looking for. Therefore, I humbly request you to come and talk to us, and I know there is a lot of wisdom we are going to get from you. Give him a thunderous clap, ladies and gentlemen. Another clap, please. And can you dance for him, please? Thank you.
Angela, so your WhatsApp is not on. You see, you have to be innovative wherever you go. So she knows my name, so I also asked her name and her number, and I sent her all the dancing you did here. I sent it to you.
Thank you so much.
So the acting Vice Chancellor Makere, Mbarara University, the rector, whom I have tried to get Burundi on the board, but failed because Burundi is very difficult. Senior members of staff and innovators. Everybody who is in this room is an innovator. If you are not an innovator, you wouldn't be here. I don't have any prepared speech, and I did not prepare anything to say, because the person who rang me will not yet come here. I told her, I'm not going to come to Mbarara because I don't know what you are doing. She said, I know you by name, you must come. If you do not come, you must come. So I am here, one, because she insisted, and she kept talking about innovation. And as Professor Kazoba has said, I believe and trust in innovation. Thank you very much for insisting, and I'm also going to invite you. When he talked about me, he forgot to say that I am a retired academician and now a farmer. Completely a farmer, but have continued with innovations. I retired because I thought I had given enough to the academia. Some of you may know that I was the DVC, Finance and Administration. That's when I looked for that money for research, for universities. And the money that you got, actually, I negotiated that money before I retired. 20 billion for the other universities, public universities. So you are supposed to get 20, but shared amongst yourselves. And when they approved it, the following week I was retiring. Now I understand they didn't have enough money. So they gave you one, Bustema, one, but I think you don't know what they gave them. Because I sit on their council, and I think the man who was giving, he said, Bazi is there, he's going to shout, so he gave them slightly more than you. But you'll get more. And I can promise you that we are going to negotiate more money for innovation and research for public universities, and we shall have it. Few things I want to say about innovation. Most of these universities you have heard of, Harvard, MIT, Johns Hopkins, Stanford, they have survived and grown because of innovations. The only difference is that for them, they did innovations and they had people to appreciate them and fund them. So we are doing so many innovations. I was in the other room. Everybody who presented in the other room to me actually won and deserves funding. I was talking to my colleague Cosmas in the Ministry of STI, where I'm supposed to be the chair of the National Research Innovation Fund. They don't have money. Our ministries cannot have money that we need. Therefore, we should expect very little from them. So where is the money for innovators? Is it there? Yes. Can we tap it? Yes. Why don't we tap it? Because we do not know where it is and how to get it. I would ask you to write down, if you have where to write. There's a book called Ask Without Fear. That book talks about why do people give. You can buy it online. If you are my friend like Angela, I will send it to you, because if I send it to you, because I bought it, Amazon will not charge you. You download it free. And I will send you a copy so that you can send it also to some staff people. Why do people give? People give because they are asked. If I don't ask you to give me any money or any medicine or water, will you give me? No. It also goes on to say, how would you search for those who are willing to give? That's why I want you to read it. Or listen, you can download the audio. There are so many websites which you can go on and you say, I didn't know I could get money. There is so much money for innovation that we can continue to tap in. My biggest award grant for innovation was $20 million, which was in engineering, and I'm a medical person. I wrote this, and my colleague said, this time, Baze, you have run mad. And we beat universities like Duke, MIT, and others, and we got this money into the School of Public Health. We supported universities in African countries, including Uganda and many others. And we have in our basket more than 160 companies that actually got innovations and now have business in this country. We gave out grants, startup grants of $100,000 to many groups. And unfortunately, CamTech, I was asking Dr. Data, he didn't know where to look for the money. So you never got. But now, when our project ended, we were given a 10-year no-cost extension, meaning they were not giving us direct money. And what they did, they allowed us to source money, but under the same project. And we have now sourced $48 million for this country and these partners that we have. Now we need to now make it a member so that it can benefit from this. Burundi, that's what I'm talking about to you. So I gave a promise to Dr. Data that as much as I am retired, since I'm still in this business, we shall work together. And the CamTech should get money and do innovations. When you look at universities and in Japan and other countries, you find that they have grown because they sell their innovations to their communities. I'll ask you a simple question. How many industries in Uganda will buy what we have seen presented here? Most likely zero. Why? Because when you organized this meeting, you didn't know that they are the potential buyers, so they are not here. They will read in the papers, but they will not come because they have not heard. So we need a communication strategy to identify who is my buyer. If I said those who are there and the Cosmos will agree, nearly all of them are potential for procurement. But nobody will procure you. So we need to have a communication strategy. And in that project of mine called Resilient Africa Network called RUN, after we got the money, we hired one person whom I sent for training in Tulane, Stanford, and the Texas A&M, just for one thing, to learn how to communicate what we innovate. If I were you, which I am not, I would send Angela for that training. And you will come and see. Angela, you can actually apply, come and we train you what we learned there. This will be free training. We shall cater for all your needs in Kampala. And if you don't want to come by road, I hear there are planes that come here. Yes. Yes. We have somebody here, I'm not going to say her name. She's on one of our projects. And she says, I don't like potholes when I'm coming for these meetings. We always airlift her. She's your member of staff. Yes. We value your brain. So Angela, I'll give you a contact. You can come, train through that. But don't abandon this university. Because she may train, there are so many universities they may want to poach. Coming back to this event, I'd like to congratulate the university. Please send my regards to Professor Obua. Professor Obua was a close friend of mine. And for your information, before he came here, when he was looking for people credible to be their referee, I was one of them. I want to thank you as the university for organizing this and all the time. And I want to thank Dr. Data and his team. But I want to add one thing, that we can remain innovators, and these people who are here, I guess most of them are students. They are going to leave. They are going to look for jobs. I'm going to talk about jobs as well. Before they leave, let us grow them so that they leave with actual businesses that will make money. Some of you have heard of the Innovation Village. How many of you have heard? How many of you know how it started? We started it with our project. And I'm so proud that it has spread, trained, and skilled people. I don't need anything from them. What I need is that, can they pass on the same knowledge? Prof, let us find time when I'm not at the farm. You can come at the farm. When you come at the farm, shall first talk about animals. I love animals. Shall talk about animals. If you don't want to look at them, I was telling these people, me and my staff, we have stopped suffering from what people are complaining about. This acaricide that you buy and it doesn't work. We have an innovation on our farm. We use our own locally prepared acaricide, which doesn't have those chemicals. And our animals are doing very well. They are saying, now you look for party. I don't need those things. Me, I want my animals good. Whoever is a scientist, he can come and we talk. But let us find time. As you said, I am a businessman. No single university, and I say it here, I will say it tomorrow, I will say it the other day, no single university will survive without operating as a business entity. If you see your university leadership working on academia, just marks, grades, 4.99, that's not the right thing. You must teach students to think academia with business. And Cosmas has been in these schools. MIT, if you go there, the first thing is they develop your mind to business. Then you learn whatever you are learning and interpret it in a business way. Our curricula has for a long time trained academicians. We have thousands of trained academicians. We have very few academicians who are business oriented. These innovations you have seen here, and unless they are turned into business, they are not innovations. So, Prof, I offer that once you have time, but when you are coming, you also come with Angela, because she was going to record and come and disseminate what they have. Professors, they don't know how to disseminate. You must train the people, the right people, to do their work. Don't try to do the work that is not yours. I've seen a group here, and I saw it there. Maybe I don't. Have they finished adding the marks? Okay. So this group has a leader who pitched there. His pitching is like, you bring those goats and bring, I'm just giving an example. That pitching is 3 minutes. They have told you. Now what you are saying in the introduction, which does not cost any mark, takes 2 minutes. Then what do you expect to score? When we got the 20 million, we were 6 universities from all over the world, and Africa had 1 university, which was Makerere University School of Public Health. We were given exactly 3 minutes, because that was the decision whether you take the 20 or take 10, 5, 5, 5. I finished my pitch in 2.5 minutes, and I sat down. The end result was I came back with the 20 million. We need to learn our strengths. If on the team of innovators, you may be very good, but not very good at pitching. Train one person who knows. I saw the last team where this girl was pressing the button and one young man was talking. Get such a person to understand the project. Then he pitches. You can watch. You do the technical work. So, Professor Kazoba, I'm going to be available. I come this side regularly. You know why I come? Because I have interests. And this is my first time since Mbarara University was built. I've never been here. Never. One time I was invited as an external examiner, but then I was traveling out of the country, so I never came. But these other times, whether you have graduation, when I'm passing, they say they have graduation, they are building in Chumro. I say, okay, one day I'll come there. So let us arrange. The other thing that I'd like to put into you, there are so many search engines, as I said, for these resources. And there are many people. I was telling him yesterday, I was watching this innovation of producing mosquitoes in millions. How many of you watched it? millions of mosquitoes produced in 1 minute. Now they want to export them to countries where there is malaria. Those mosquitoes do not carry malaria, so they will come and kill these mosquitoes here. I said, hey, remember somebody wrote a proposal, last funding. We didn't give him money because the teams that we had which were evaluating, they had one question. We produced these mosquitoes. When they have finished the other ones, what happens? But I think we fell short. We could also have another group design a model to do what? To finish them. But maybe we shall talk about it. But I watched it. This is funded by Bill Gates. Ladies and gentlemen, ask and you will get. Many of you do not know Bill Gates, but you read about him. I wanted money in the School of Public Health to do something. And Makerere didn't have money. The government wouldn't give me money. And I was the dean. So I said, as a dean, I can't get this money. So I Googled Bill Gates, Melinda and whatever. I found that the contact us. No, normally websites have this contact. Some of them, when you write an email, they respond. Did you know that? How many of you know that you can write to this man of X now? And he will reply. Did you know that? He will reply. I wrote this email. I told nobody I'd write this email because it would be a shame if I tell you, and then I write nothing happens. I got a response from a lady, said, what do you want? I wrote that I want to see Gates. The second question was, why do you want to see him? I said, I have an issue, and it is in developing countries. And I know that is his interest. She said, can you share it? I said, no, I want to share it with him. To cut the long story short, they invited me, paid for my ticket. I went there, I saw him. Our meeting was less than 5 minutes. Because they said, when you enter the office, don't shake his hands. Just sit on the table. They showed me the previous day. You come in, 2:30, open the door, sit, talk to him. I said, in African culture, it's not normal. I come to your office, I don't greet you. I said, no. So I left that lady. When I came, she said, enter. I entered, I went straight to him. I put my hand. He shook my hand and he greeted me. So I sat. He said, oh, so young man, what brings you to America? Yes, this is true story myself. I told him the problem. The problem were asbestos roofs on our buildings for School of Public Health. And he said, so what are you going to do about them? I don't like asbestos. You want me to remove them? I said, if you give us funds, we'll remove them. He said, who will remove them? I said, there is a company. It gave us a quote. He said, you know how much? I said, yes. He said, it's done. Then he said, there is another problem in Africa. People smoke. Can you plan? And we have another visit and talk about smoking. He called his secretary. She came. He said, he gives you the account and you put there the money they need for what his request is. I went out. I didn't have the account number because the account number is the university number because the money was not coming to me. So I told her, When I go back, I'll send you an email. I went back to my hotel. I asked her, but now you booked 5 days. My meeting is over. Can I go back tomorrow? Said, yeah, let's change your flight. So the following day I was on the flight. Emirates, first class. The first time to fly first class. Because Gates does not buy business class if you are flying more than 8 hours. It is first class unless it is not there. I came back, got the account, sent it, the money came to Makerere. The rest is history. All the buildings were renovated, and the NEC took all the asbestos, and we have, at that time they were new, but now I think they are getting old. 10 years ago, we renovated our buildings. Why am I telling this story? Ask. If there is a need that you must talk to the vice chancellor, the deputy vice, go to him. The worst he can do is say no, but he won't kill you. Can you kill? You'll say no. Students, innovators, ask. When you see these industries, ask them. Yesterday, the minister was here. I talked to him when he was coming here. I rang him for some other reason. He said, I'm going to the university. After that, I go to Kampala. I say, I'm going for a burial in Bushenyi. You don't know this? He said, I know, but I didn't know that their mother died. I said, you find us. He came there for burial. From here he came. When he was here, how many of you asked him? This Cosmas here, ask him questions about money. Now, let me talk about BPO. Yeah, if he refuses, just send me a WhatsApp. But don't call me. Because if your phone is not in that phone of mine, even if you call 1,000 times, it will never go through. That's why I've saved your number, Angela, so that if she calls, I can see. So don't try calling me. You can only send message. I say, oh, okay. That's why I asked Nadine to put her number there. Otherwise, she was going to try and miss. Let me talk about BPO. What is BPO? BPO is business process outsourcing, where we need to create jobs for the youth. I was a regular visitor to the Philippines. I'm just giving an example. They used to have all their graduates go to Dubai, like Uganda's graduates are going to Dubai, the Middle East. They are no longer there. What happened? They started what they call the BPO in their own country to serve, to work in other countries while they are at home. And they took their people back home with a minimum wage which they set for the investors. I was there with my team, with the PS and the minister and some members of the BPO council, which I chair. And I told them, these people, I left them here very poor. They are now very rich. So we are trying to be the BPO powerhouse for Africa as Uganda because of several factors. And I'm going to say them for the students to know. Some of you, your English, you are writing, is it pidgin English? You must change. It must be good English. First and foremost, good English spoken. There's what they call average hearing time. Who knows it? Average hearing time is when you talk to Professor Kazova in English, and he does not have to say, pardon me, because he hasn't understood. Your English should be that you talk to somebody and he understands right away. When you look at our friends in India, and please don't quote me on this, you media people, because Indians are my friends and we are doing good business, they say, this man says these things when we are not there. When they speak their English, it's terrible. But they used to have those jobs, and the Americans, the Britons, and what, would not mind because there was no alternative. Alternative is now here. Uganda has the best English. If you have read it has been ranked to have the best English in all the developing countries. Did you know that? So where do you read, you innovators? They talk about you, you don't know that they're talking about you. Don't be like the crested crane, which knows that it can get food in the rubbish, in the swamp. But when they put it to hang in Uganda, we all stand because the crane is there, hanged there. Nobody is going to tell the crane that people in Uganda respect you. But me, I will tell you as innovators, we respect you. The second thing, Uganda has so many graduates that have the knowledge. And all we need is the skills to do the right job. So that's why I stand here to say that we are particularly selecting institutions which are going to skill youth before they graduate and after graduation so that they are available. I have now about 3,000 to 5,000 jobs for nurses to work from here but work in America. Can you imagine how a nurse works from here and works in America? Many of you may not imagine, but those things are available and they work and they get good money. Road parking in Malaysia, in Australia, in Singapore is controlled in the Philippines. There are no officers in Singapore for road parking. Can we get one country and we park like Ukraine? How many of you are planning to go to Ukraine? We have just signed with Romania as BPO so that we train our people with the Romanians, and when they stop their fighting, we take the jobs where? Of Ukraine. Some of you will be here, so we'll skill you. So we are particularly looking for institutions, and I was telling Dr. Data that you may actually house a BPO skilling center as Mbarara University, so that all of you get skilled. And this question of saying, I don't have a job, I'm going to, no, those things are going to end. We have signed several, and I'm not going to say how many we have signed. Those who are waiting for one thing, and I said it the other day when we had the president, and I was making a request to him in Kororo, for him and his cabinet to just approve our policy, which we drafted. Once it is approved, jobs given. Now, these innovations of yours, my advice is, you see, you would present there, who is your target? Ministry of Health, URSB. Can you now think of targeting using them in those countries that they don't have? Let me tell you, my brother here from Burundi, the rector, we can deploy all these people to help you, Burundi. Burundi has a lot of problems. Yes, but we can help them as they grow. I was in DRC last week. They need us yesterday. Some people here just say, DRC has money, has people who need support, have institutions that you find in a whole big institution. The highest person has a qualification that most of you think that when you have, you can't get a job. We need to help them. Other countries started the same. The third thing that we have for BPO is the government support. Nobody is going to hire Ugandans to work on BPO if they don't have government support, because how will they control the people to work? You are in office at the right time. So the work culture must be through the government commitment. The third thing, internet. I come from a very, who knows where I come from? Not where I shifted to. Where I came from, many of you, you say you also study. Up to now, the people there, the education is not a big deal. But that place has internet. And internet has now been reduced to $35 per MB per month, and we are looking to bring it lower. It was reduced because BPO Council recommended that we need this internet down. And we have said, what you have reduced, can you do more? And I think they will do it. So internet penetration. People who study and live in Mbarara will not have to go for these jobs that I'm talking about in Kampala. You work from here. You work from where there is internet. And you are paid. $2,000 is no big deal. Uganda cannot pay us all. But there are other countries who don't have us, and they need us. So Uganda should benefit by marketing our own people. They work there, they bring the income here. The last thing which I wanted to say last, there are many others that make Uganda a lucrative place, is our age. Who knows the average age of our youth? I know you are going to Google. We have the youngest average age on this continent and worldwide. Those who are young and in the bracket of education and academia with qualification. 16.49 years. Other countries have their youth at 20. So our people can work longer hours. Our people can absorb and learn faster than those people because our people are young. So these countries that are surrounding us and in Africa, we are ahead of them. All we didn't have is we didn't know where to ask. Now we know. I can give you a promise that our council will deliver jobs once some of the things we have asked government, they are put in place. People should have those innovations and grow them into business and use them. Don't think that it's only Uganda which can't afford them. Many other countries can't afford them. So if you do them, other countries will buy, and you'll work there. And as I said, Resilient Africa Network, our innovations have been bought by many countries. You were here doing pedal tap, that COVID has come, these people make machines that you step on. That was an innovation by a small girl in engineering, you know her. When we took her to the US for pitching, she was the best. One of the people in the audience was these people who make this thing for babies, the powder. Yes. The lady stood up and said, I have given that one 600,000 to go and modify their what? Their innovation. So this girl came. The money didn't come to Resilient Africa Network. We gave all the 600,000 to who? What is her name? Grace. And now she partnered with some team and made several of them. Ugandans before COVID didn't know them, so they didn't buy them. Where was the market? Rwanda. She made money. She lives in a comfortable house. And people who, we patented it for her, but you know Ugandans don't respect patents. So they go, but one day we shall reach there. I know I should have spoken a few words, and I am actually on the road going back to Kampala because I have a meeting tomorrow, 9 o'clock, which I am chairing. I wish to stop here and wish all of you, innovators, success. Secondly, I wish to say that if you do not have this capacity of growing people that write successful proposals, Professor Kazova, I'll give you a team that I've worked with. We are now writing for a grant. You know, there's who is going for COP28? COP20, you are going, you know that there's money. So for us, we are writing pre. So that when I go with my team, we look for those who have the money. Because one team has pledged 1 billion. So for us, we are going to write something around there. We will go with it. Climate, it is health and climatic change, correct? But before I go to that one, I'm going to Panama. There is one, COP3, which is health and tobacco. So that we go there and get some money, come and invest in our country, in our innovators. With those very many words, thank you very much for inviting me. Dr. Data, this is a man that I have heard his name. And I have wanted to work with him for a long time. But I have never seen him. I have always wanted to work with this man. Now that we have known each other, let us take advantage of our knowing each other, and we grow the team even much bigger. He told me what he wants. Because he was very sharp, he asked. So I'm going to join him and we look for that money, which he has asked me. And when we get it and bring it here, please tell them that when we are here, I promise that we are going to look for it. God bless you. Thank you very much, and God bless you.
Thank you.
Guess why I'm smiling? Once again, let's thank our guest of honor, Professor William Bazeo, for speaking to us. I'm requesting for a moment of silence. While we're here, they have told us a colleague of ours has collapsed dead on his farm. He just went to his farm, and they're transporting the body now. Kelly has passed on from the Faculty of Applied Sciences and Technology. A moment of silence. May his soul rest in eternal peace. We thank God for his life and for what he has done so far in the university and for his family. But let me not kill the mood of innovators. Please rise up, innovators. Innovators, stand up. The results are here with me, and I have them in capital letters. Yes. Why are you stretching? Why are you stretching? Do you know the person who has been speaking to us? What is his name? Huh? Do you know how many donations I've gotten from this speech? What is the name? I still need my job. Professor Ba? Now let's write his name. Professor Bazeo, we're writing your name in capital letters using our bodies. B, let's go, B. That's P. Down, up, and the judges are not doing anything. I'm looking at them. Judges, we're writing professor's name. Okay. We go down B, B, up, this, the small stomach, the big stomach. Don't sit. Nangaka, please go down. Thank you. Up. A, let's go down. A, up. Move a bit, move a bit. Down, up. The middle thing. Okay. Z. Z. That is S. Z. It's sharp. Z. 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 Okay. Letter E. Down. Down. Up. Middle thing. The down one. Okay. Y. And the female. Can I see the Y? Down. O. I don't know what you've written, but it's okay. Thank you. We've stretched enough. At this moment, I invite Dr. Data to take over this part. It's the award ceremony.
Thank you. We just want to welcome one female judge and one male judge to give us a few words of what the judging process was like. And then after that, I'll invite our chief guest, Professor Bazeo, to join us on the podium together with our Deputy Vice Chancellor, and then we will be able to announce the awards.
Thank you so much. Good evening, innovators, mentors, and everyone. I'm Dr. Nesmas Biamukama. I'm an obstetrician, gynecologist. To the innovators, the innovations were excellent. Everyone is a winner, I have to tell you that. And guess what? These innovations are actually solving the real challenges that we are facing in health. And it's great that they come out. Even if you don't get the prize today, please move on with your innovation because it is solving a public health challenge. If you do not move on with it, then the challenge that you talked about will remain there, okay? So please move on with them, go to the labs, continue discussing with people, the other technical persons, so that you get to move on your innovation, like we are told. Just a few minor things, but those were correctable. Timekeeping for some of the teams, I think, was an issue. For some of the teams, they kind of didn't bring out the innovation very well, but those are correctable, considering the time that was given to you. I wish you the best, and congratulations to the winners. Thank you.
Yeah, thank you, Doctor. I'm not going to repeat everything he said. I think all of you gave us power. There was a lot of power. Thank you, thank you, thank you.
Yes, can I have the judges please come back, the judges? Judges, please. Let's come to the front. This is for accountability. This was free and fair. Okay, our judges, I'm giving you a mentor. There she is. Yeah, stand in front of the judges. We are going to Adeso. Yes, our judges are dancing for you. Those are our judges. Move around. Follow her. Follow her. Hey, don't just joke. Not joking. We are passing here around here. Go like that. Are they dancing? Dance, clap for the judges. Clap for the judges. Are they dancing? What are you doing? Yes. Oh my God, Dr. Cosmas, you're doing well. I'm changing your name. Yeah, back to your seats. Yes. Judges will never forgive me. Yes, we're standing here. Clap for the judges. Let me stand away from them. Ladies and gentlemen, the time we've been waiting for.
Thank you so much, judges, and thank you so much, Angela and everyone. Before we announce the prizes, we want to specifically recognize the sponsors of this event. In no particular order, we want to recognize the First Mile Project, through Massachusetts General Hospital. We want also to recognize NITA Uganda for powering the internet. We want to recognize the World Intellectual Property Organization for financially supporting the hackathon. They are not represented here and they loved to come. The International Federation of Pharmaceutical Manufacturers Associations in Geneva, Switzerland. They supported us. And Equity Bank funded part of these events. As we also heard, the cocktail was funded by the Center for Innovation and Technology Transfer. Thank you. There are so many organizations that might have not funded directly, but we want to recognize the following organizations that have sent mentors to support. So the Uganda Registration Services Bureau, Ministry of Science, Technology and Innovation, UICT, thank you. NITA Uganda, thank you so much. The Ministry of ICT and National Guidance, we are internally grateful. Now, the Embassy of Uganda in Burundi. Professor Bazeo, of all the foreign missions of this country, the Embassy of Uganda in Burundi is one of our favorite. They have done so much for Camtech and for its visibility globally. We want to thank the following universities for being represented here. So, University of Ngonzi from Burundi, thank you so much for coming. Representatives from University of Kabale, we appreciate you. Representatives from Ankole Western University, we are grateful. Representatives from Denje University, thank you. Ecury in Kampala, thank you for coming again and again. Mbarara University of Science and Technology, we can't be more grateful. Kampala International University is here. Bishop Stewart University is here. Mooney University is here. Makerere University Business School is here. Makerere University is here. So almost all universities in Uganda are here. We are so thankful. And now, I would like to invite Professor Kazoba to come over with our chief guest, Professor Bazeo, to hand over the three awards. Now, these 3 awards, once you have received them, please meet Nuriat as a team, because it's a cash award, so you will be able to meet Nuriat after you have discussed who is going to get that cash award on your behalf. We hope this cash award starts to be the first thing you write on your CV, okay, of your team. And so, don't scramble over it. Let that be your first investment and grow it. Okay. And for all the rest of you, you are all winners. Because after this, we are going to send you emails, and then the journey for innovation starts. This was just the spark. And we are committed to getting you to be the business people that Professor Bazeo wants. We have done that for many, and we are committing this to you. Thank you so much. Professors.
Okay, when they read, Dr. Data will be at the other end. Hand over the certificate. You have a handshake, golden handshake, up to the judges. My judges? Okay. It's an honor. Yeah, I need this away. Thank you. Okay, Dr. Data? Okay? Okay? Okay.
The second runner-up prize for the Camtech 2023 Medtech Hackathon.
DJ, put some tension.
Second runner-up for the Camtech Medtech 2023 Hackathon goes to Echo Detect.
Problem in all the feelings, make you try to enjoy. Bye in all the feelings, make you try to enjoy. Say kata kata uru no the finish, make you try to enjoy.
The first runner-up prize
you dey cause you drop. Shit, you know go one person. Love the way you dey dance, girl.
First runner-up prize for the Camtech Uganda 2023 Medtech Hackathon goes to Breath Tracker.
If you know how you dey cause you drop. Shit, you know go one person. Love the way you dey dance, girl. I am ready. Why get kind of fire? Mommy, be cool. Let's hop in my Maserati. Baby, hop in my Maserati. I said hop in my Maserati. Hop in my Maserati. Girl, I wanna see you go down. Yeah, send me.
Winner. The number one, the topmost prize for the Camtech 2023 Medical Technology Hackathon
will be announced tomorrow.
All right. knew
Oli
that.
muwanguzi muganda wange topowa togwa musubi.
I will never be a loser. Now only winner. Tomo watu fuka loser.
Nawo mufuzi wa bodo oli muwanguzi. Afuka bode chilo mumpewo ngononya ziweza wa mawuche. Asindike chikali oli muwanguzi. Afuka taxi no conductor muli bawanguzi. Temukwa musubi.
Very good. For a total price of 2.5 million shillings.
Oli muwanguzi muganda wange. Topowa togwa.
The grand winner of the Camtech 2023 Medtech Hackathon is Mama Wea.
Nawe mufuzi wa bodo oli muwanguzi. Afuka bode chilo mumpewo ngononya ziweza wa mawuche. Asindike chikali oli muwanguzi. Afuka taxi no conductor muli bawanguzi. Temukwa musubi. Kano kayimbye nkajja ku mutima nange neebuuza zani wamma gwe bavuma mufana n'ekima kati kuba shows ne ziwuma nga nasomba scrap n'ebyuma ng'abalala bagamba nkyuma mu baana bonna tebaŋŋema mu byaddala obulwadde bwannuma n'okusoma blood kwalema saapu era obulamu tebwantama nze kyemmanyi katonda gy'ali nasula ku kapeti ng'obuliri tewali n'ebivulo ebyali ku 12 omutujju nayitanga mu kituli ng'obuzibu muzeeyi bumaali n'abakazi nga bampita bbali kati ndi wina ebankubira entoli tabo tabu oli muwanguzi omuyimbi akyeyiya olaba edikeza ava ku street n'atuusawo stamina.
Congratulations and celebrations when I tell everyone that you're in love with me. Congratulations and jubilations. I want the world to know I'm happy as can be. Who would believe that I could be happy and contented? I used to think that happiness hadn't been invented, but that was in the bad old days before I met.
And a special announcement from our chief guest. The overall grant winners have just received dinner worth $100 US. Thank you so much, Professor.
Congratulations and jubilations. I want the world to know I'm happy.
So after this photo moment, the Camtech management is going to send you a link to provide feedback on the Medical Technology Hackathon. Please tell us what we can improve and also what we did well. And so after here, I request the DJ to give us really hot music, and then we will be able to leave it large at will. So, thank you so much to our organizers, our mentors. Thank you and thank you.
By the powers entrusted to me as the CEO of the university, I declare this conference, the 29th Annual General Conference of Camtech, closed.
DJ, music.